So guys, this is part 3 of the previous model paper. Let's discuss the next question. Daily adult dose of INH is 100 mg, 200 mg, 300 mg or 400 mg. So INH is isoniazid and its daily adult dose is 300 mg. Moving on to the 52nd question, an acid-resistant penicillin is methicillin, cloxacillin, dicloxacillin, or penicillin V. Penicillin V is an acid-resistant penicillin which is used to treat certain infections caused by bacteria such as pneumonia and other respiratory tract infections. Heparin antagonist is protamine sulfate, procaine HCl, procainamide, or procarbazine. So the heparin antidote is protamine sulfate, which results in the neutralization of heparin. Now the 54th question. This integrator works on the principle of attrition, grinding, impact and grinding. The right answer is impact and grinding. Fertilization of ovum takes place in ovaries, cervix, fallopian tubes or uterus. The right answer is fallopian tubes, option C. Anti-carcinogenic agent source is Vinca rosea, capsicum, belladonna, or ipecac. So Vinca rosea is the correct answer. They have cytotoxic effects that can arrest the division of cells and cause cell death. 57th question. The average number of platelets in 1 cubic millimeter of blood is 1 lakh, 3.5 lakhs, 1.5 lakhs, or 5.5 lakhs. The right answer is 3.5 lakhs. The concentration of sodium chloride in normal saline is 0.09% weight by volume, 9% weight by volume, 0.9% weight by volume, 1.9% weight by volume. Normal saline is 0.9% weight by volume. The HLB system is used to classify colors, flavors, perfumes, or surfactants. It is used to classify surfactants. Normal renal creatinine clearance value lies between 10 to 20 ml per minute, 30 to 60 ml per minute, 80 to 120 ml per minute, or 100 to 200 ml per minute. The right answer is option C, 80 to 120 ml per minute. Moving on to the 61st question. Enteric-coated tablets disintegrate in mouth, stomach, intestine, none of these. So enteric-coated tablets disintegrate in intestine. They are specially made to disintegrate in intestine. Gardinal and Luminal are brand names of cyclobarbitone, phenobarbital, butobarbital, or barbital. They both are phenobarbital, option B. Now let's see the 63rd question. Zovirax is a brand name of allopurinol, amantadine, acyclovir, or acetazolamide. And the correct answer is acyclovir, which is used to treat infections caused by certain type of viruses. The popular IUCD is copper T, condom, cream, or foam tablet. IUCD is intrauterine device, and the popular one is copper T, which is T-shaped birth control device that is inserted into the uterus to prevent pregnancy. Capsicum used in OTC liniment is to produce easy spreading, for its odor, to produce warmth or heat, or none. So capsaicin, the active chemical in capsicum, can temporarily relieve chronic pain from several conditions. The answer is to produce warmth or heat. 66th question. Solvent used in throat pains is syrup, castor oil, glycerin, or alcohol. And the right answer is C, glycerin. The chemical name of vitamin C is ascorbic acid, benzoic acid, cinnamic acid, or malic acid. Vitamin C is ascorbic acid. 68th question. All are amino acids except lysine, leucine, tyrosine, or phenylalanine. I guess here the question could be all are essential amino acids except. The answer would be tyrosine. Tyrosine is a non-essential amino acid. Demography includes the study of all except mortality, morbidity, fertility, social mobility, and marriage. So the right answer is morbidity. Pyridoxine is vitamin B1, vitamin D2, vitamin K, or vitamin B6. So pyridoxine is vitamin B6. Antigens belong to the schedule C, schedule C1, G, or H. Antigens belong to schedule C. The next question, 72nd, Epsom salt is MgSO4 twice 7H2O, MgCl2, MgO, MgOH2. Epsom salt is magnesium sulfate, so option A would be the right answer. 73rd question. Anti-AIDS drug is zidovudin, ranitidine, terfenadine, amantadine. The answer is A, zidovudin, which is an antiretroviral medication used to prevent and treat HIV or AIDS. Ashwagandha is the dried roots and stem barks of Withania somniferum, Anethum graveolens, Cassia angustifolia, or none. Withania somniferum is the answer. The instrument used to determine the optical activity is polarimeter, spirometer, refractometer, or pH meter. So the correct answer is polarimeter. Myopia is corrected by convex lens, concave lens, cylindrical lens, or plane lens. Option B, concave lens, is used for myopia. Moving on to the 77th question. Protein energy malnutrition causes obesity, cancer, glucose, or marasmus. Marasmus is a type of malnutrition mainly seen in developing countries. Now let's see the 78th question. Goiter is caused by the deficiency of iron, zinc, copper, or iodine. Iodine is the right answer. Polysaccharide present in liver is starch, lactose, glucose, or glycogen. Here the answer is D, glycogen. 80th question. Mantoux test is used for diagnosis of typhoid, TB, leprosy, or diphtheria. Mantoux tuberculin test is one method of determining whether a person is infected with TB, Mycobacterium tuberculosis. Aldosterone regulates blood sugar, serum calcium, urine concentration, or sodium absorption. Aldosterone regulates the urine concentration. 82nd question. The process of blood clotting is initiated by fibrinogen, prothrombin, thrombin, or thromboplastin. The correct answer is thromboplastin, also known as tissue factor, which initiates the blood clotting. The next question. The name of the first cervical vertebrae is Axis, atlas, ulna, or radius. The first cervical vertebra, atlas, is unique in the sense that it possesses neither a body nor spinal process. Next one, the nerve of vision is olfactory, optic, auditory, or vagus. The answer is optic nerve. Growth hormone is secreted by posterior pituitary gland, anterior pituitary, thyroid hormone, or parathyroid gland. Anterior pituitary secretes the growth hormone. An excess of nitrogenous waste in the blood causes uremia, anemia, acidosis, or alkalosis. So the condition is uremia, which involves abnormally high levels of waste products in the blood. 87th, non-electrolyte is potassium chloride, sodium chloride, dextrose, or calcium chloride. And the answer is dextrose, which is a non-electrolyte. Use of pyrethrum is bactericide, insecticide, pesticide, or fungicide. Pyrethrum is commonly used as an insecticide. Mays reagent is used to test alkaloids, glycosides, carbohydrates, or proteins. And the answer is A. Alkaloids. Anti-diabetic drug is Gymnema, Ni, Ashwagandha, or Colchicum. And the right answer is Gymnema, which controls sugar. Now let's move on to the next one. Bleomycin belongs to the schedule C, C1, G, or H. Bleomycin belongs to schedule G. It is a type of antibiotic that is only used in cancer chemotherapy. A gold compound used to treat rheumatoid arthritis is sodium antimony gluconate, sodium orothiomalate, calcium gluconate, or titanium dioxide. The right answer is B, sodium orothiomalate, which is a gold compound that is used for its immunosuppressive anti-rheumatic effects. Anti-flatulent used in the antacid preparations is selenium sulfide, simethicone, titanium dioxide, or silicon dioxide. So option B, simethicone, is the correct answer. Moving on to the 94th question. H2 receptor antagonist to treat ulcer is famotidine, pantoprazole, misoprostol, or megaldrate. So famotidine, which is a histamine H2 receptor antagonist medication, decreases stomach acid production, hence used to treat peptic ulcer disease. Non-sedative antihistamine is cetirizine, diphenhydramine, clemastine, or chlorpheniramine. Non-sedating one is cetirizine. Now let's move on to the 96th question. Drugs for free distribution to physicians should contain the words on label physician sample, not to be sold, both A and B, or none. The right answer is physician sample and not to be sold, both A and B. An agent used both as an antacid and laxative is magnesium hydroxide, magnesium sulfate, magnesium nitrate, or magnesium trisilicate. Option A, magnesium hydroxide, is used both as an antacid and a laxative. Plaster of Paris contains dried calcium sulfate, dried calcium phosphate, barium sulfate, or zinc sulfate. The answer is dried calcium sulfate. 99th, which of the following function is important for managing? Planning, organizing, controlling, or all of the above? Actually, all of these are important for managing. Last question. Antidote for cyanide poisoning is sodium benzoate, sodium bromide, sodium citrate, or sodium thiosulfate? So the correct answer is option D, sodium thiosulfate. Hence, we completed the model paper 1. You can check out the previous parts 1 and 2. Subscribe for more videos.